30 years ago, Dundee, along with Edinburgh, not only had more injecting drug users than other parts of Scotland, the two cities also had much more of what was then a new problem related to addicts sharing needles.
There is now a danger that has become a threat to us all.
HIV, the virus which can lead to AIDS, was a new threat and at the time was untreatable.
So don't die of ignorance.
Methadone, a heroin substitute distributed in liquid form, was introduced to encourage drug users into the health system, to give them advice, clean needles and healthcare. In terms of public health, it worked, helping reduce HIV infection rates in places like here in Dundee. But 3 decades on, methadone's facing a number of criticisms, not least from people like Michael here in Dundee. Methadone, how long were you on it?
20 years plus.
That seems extraordinary.
It is, it's incredible. It suppresses every feeling, every emotion, your sense of sight, your smell, everything.
I suppose the counter-argument is that, yes, it has a numbing effect, but it does help you become reasonably stable on an even keel and help get
used in the right manner, I believe that it would work. But then putting people on methadone and then just forgetting about them is not the way ahead. It's just so wrong.
Of Scotland's 61,000 opioid drug users, more than a third are on methadone, and critics say some, like Michael, are effectively parked on it for years with no progress in terms of weaning them off their habit. It's estimated that around 8,000 drug users have been on methadone for more than 5 years. In addition, it's been linked to a number of drugs deaths because some users continue to inject heroin while using legally prescribed methadone as well as illegal fake Valium tablets, as we reported on this programme last month. So, what's the alternative? One is a relatively new treatment called Suboxone. It's a combination drug made of buprenorphine, which mimics the effects of heroin, and naloxone, which blocks the impact of opiates. Michael, a drug user here in Dundee, has recently switched from methadone to Suboxone, and 8 weeks in, he can't believe the difference it's made to his life.
Now, life is like a drug. I just feel awakened. I feel like everything's here for me, and I'm here to give everybody something back.
And how long have you been on Suboxone?
This is my 8th week into treatment, so very early days, but it's just astonishing how good it is. Not good in a manner that I'm sitting wasted or out of my nut, yeah. But I'm here, I'm a member of society.
You're feeling like the real you?
Yeah.
So this is our memorial garden, and it's called the Garden of Hope.
But while Suboxone seems to be working for Michael, Dave Barry of the drugs charity AdAction in Dundee says the important thing is to find the right way forward for each client.
That could be from residential space to community. Some people will want to try a very quick and rapid detox. Other people may want and need to be maintained on a drug for quite a while, sometimes years. So it very much depends on the individual.
So, hello everybody.
But then the debate becomes just how far society's prepared to expand the toolbox for helping drug addicts.
Our Swiss experience with you here in Scotland.
Dr. Thilo Beck, a Zurich doctor speaking in Glasgow 2 years ago about Switzerland's approach to drug treatment. As well as methods such as methadone and buprenorphine, they also have legal consumption rooms where users inject heroin supplied by prescription under medical supervision. At Holyrood, MSPs have just voted to allow a similar safe drug consumption facility in Glasgow, but it can't yet get the full go-ahead because drugs policy is reserved to Westminster, meaning that those using it and staff working there could be prosecuted unless the UK government changes the law. SNP MP Alison Thewlis has published a private members' bill to change the necessary legislation, but so far at least, while the item is now on the agenda, the Home Office insists that its approach is to prevent drug use in communities and to support treatment and recovery, adding there are no plans for drug consumption rooms. In Dundee, where drugs deaths per capita are the highest in Europe, the City Council has convened a drugs commission involving the NHS, the police, the council and charities, which will meet for the first time later this month. SNP councillor Ken Lynn is commission chairman.
These 12 deaths in January, for example, that's the number of people affected by that. A lot of them would have had children and extended families, of course. So there's a heartbreak spreading throughout the community as a result of that. And I would hope that if people start to see as a result of some radical solutions that the number of drug deaths coming down and coming down substantially, I would hope that'll win people over But I realise that at the outset, if we pursue radical solutions, it may not be a comfortable place to be for some people.
10 years ago, the Scottish Government published its national drug strategy, The Road to Recovery, with its main aim to get users drug-free. The next phase, the Substance Misuse Treatment Strategy, was meant to be published this spring, although that timetable has now slipped to the summer. Dave Liddell of the Scottish Drugs Forum says the time has come for some real blue sky thinking, and even if Westminster blocks consumption rooms, new drug treatments, including one just approved in the States, offer new hope.
I think it's an opportunity now with a new strategy coming out fairly soon to actually ask ourselves, well, if we were starting from scratch, what would our services look like? And I think that's quite challenging when we've spent 30 years building them up. And for example, there is now a preparation which isn't licensed as yet in the UK, but is a slow-release buprenorphine where people would get an injection once a month. Now that would obviously mean that people wouldn't have to attend the pharmacy on a regular basis.
And if recovering drug users can avoid having to go to a pharmacy every day for their prescriptions to be dispensed, they can also avoid being preyed on by dealers as they run the gauntlet to and fro. Michael again.
I'm offered drugs every day where I go and pick up my prescription. I just have to turn around and say, no thank you, I'm not interested. They're so readily available. I mean, I can make a phone call now and I can get any drug I would want.
This is a battle that you've been fighting one way or another for a very, very long time.
Yeah.
For most of your adult life. You're 8 weeks into your treatment. How hopeful are you of the future?
100%. It's like you've been sedated. I've been sedated for 20 years and I'm now coming out of being sedated and I'm actually finding that, you know what, life is great. It's lovely.